I always thought that I had earned a get out of cancer free card. I was working at the hospital in a cancer center for 20 plus years. I worked at the American Cancer Society for the last nearly 16 years now. But in 2008, I had been having back pain and didn't know the reason. Called my doctor, went to see him several times, but never really figured it out until it got bad enough that I needed to get some further consultation. And when I did, it was discovered that I had a soft tissue mass on my spine as a result of having advanced stage multiple myeloma. Myeloma works, it starts in the bone marrow, and then it grows out through the bones. So I had lesions in all of my large bones. I had several broken ribs. So it was a very difficult diagnosis to hear and to experience. Having worked in the cancer center, I knew that it was not a good diagnosis. And the doctor, when he came to see me that first morning, he said to me, "You have about a 5% chance of living 5 years." And so I said, well, I always knew from working in the cancer center that my first chance was my best chance. So I said, let's go at it with everything we've got. And so I started on a regimen of thalidomide and Velcade. I took radiation therapy. After about 6 months of being on the chemotherapy regimen, it was recommended that I get an autologous stem cell transplant. And so I went to Hershey Medical Center. My caregivers and I stayed in Hershey Hope Lodge, which is absolutely amazing. If you ever get a chance to go there, you absolutely should take a tour. And so I went through the stem cell. It was difficult, to say the least, but after going through that, the doctor, my blood work showed that I was in remission. And at that point, the studies that were being done showed that a tandem stem cell transplant was the best chance of cure. So about 4 months later, I went and had a second stem cell transplant. And through all of this, of course, I was wondering, having, of course, working at the American Cancer Society at the time, I started looking at how the American Cancer Society might have participated in helping me get well. And I learned that in 1991, Dr. Sivan accepted a grant from the society, and he developed a machine that was able to harvest stem cells. In 2003, Dr. Barloghi at the University of Arkansas accepted a grant from the society, and he looked into the use of Velcade for multiple myeloma, found that it was working with that. He also studied thalidomide, and for those of you who are older will remember that thalidomide was a drug given to pregnant women to help with severe morning sickness, and it caused terrible birth defects. And so as they were looking at this, they knew, of course, that it inhibited cell growth, so they started looking at it in the use of cancer treatment. Both of those drugs proved to be effective, and along with the stem cell transplant, by the time I had been diagnosed, actually about a year, the doctors told me that with all the studies that were coming back, that my odds of survival were 30% in 5 years. It's now 10 years. Actually, it was just 10 years yesterday, and I am doing well. I had a relapse in December 4 years ago and had to start back on treatment, but it was the Velcade and Revlimid, the newer version of thalidomide, and so I was able to go right back on those medications, and my doctor said that all of my blood work looks great. I am continuing to be in remission, and the point that I want to make with my story is that every day research is coming home to someone in your community to make them well, whether it is Herceptin, a drug for breast cancer, or it's Velcade, or of course the thalidomide and Revlimid, Gleevec, a treatment for leukemia. Every day those treatments are coming home to those folks in your community. So every time that you are getting ready to do a relay for life, you're selling your walking tacos, or doing a potluck dinner to raise money, or a bingo, you're contributing to saving lives. You are making a difference. And that's the story that I want you to take home with you and be very proud of the research that you are funding.